I was looking up some statistics, ladies, and I just started to educate myself. What's happening in healthcare for women?
Yes.
Who knew that?
Right?
Sex
So,
ed in high school, you failed me. You failed me.
Hey! I'm ready, 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 I'm ready. We ready, we ready, you ready? Hey! I'm ready.
Welcome to the Women in Media Show. Today, we have the honor of hosting Dr. Bisi Alli, a distinguished physician and leader in the field of lifestyle medicine. Dr. Alli is a dual board certified physician in internal medicine and lifestyle medicine, with a passion for empowering individuals and organizations to prioritize lifestyle changes towards health and equity. As the principal of WellNEST Medicine, Dr. Alli utilizes an interprofessional approach to combining group appointments, health coaching, and food delivery of whole food, plant-based meals to promote quality of life. With over a decade of experience, Dr. Alli has provided direct patient care while leading system-level interventions. She is also actively involved in various organizations, serving on the board of directors for the American Medical Women's Association and representing the American College of Physicians in the National Women's Wellness through Equity and Leadership Project. Dr. Alli's expertise spans lifestyle and preventative medicine, women's health, quality improvement, advanced care planning, and goals of care patient discussion. So we're super thrilled to have you join us on the show today. Dr. Alli, welcome to the show.
thank you so much for having me. I caught a couple episodes. You guys are doing great things. I'm excited to be here.
Thank you so much. So y'all might be wondering, well, why do we have a doctor on Women in Media Show today? Well, I was looking up some statistics, ladies, and I just started to educate myself. What's happening in healthcare for women, and what should we know about in 2024? What should we be concerned about? Because we can't show up as our best selves if we are not well, right? And so preventative medicine is important. And not only on this show do we talk about how to build your brand, how to build a successful career in media and entertainment, but before you can do all that, you have to make sure that you are well yourself. So as I'm digging, I found this statistic from the American Cancer Society, and they estimated for cervical cancer in the US for this year that about 13,820 new cases of invasive cervical cancer will be diagnosed, and about 4,360 women will die from cervical cancer. And this is from January 17th, 2024. So we want to have a conversation on how to prevent this, what you need to know about HPV, and how cervical cancer may impact someone that you love so that you can share this information on, because we can't build careers if we are not healthy and we're not here to make sure that we are building the legacies. So let's just get into the show. That is the show today, ladies. Tuned in. Make sure you stay here and share this episode, because you're going to get information that not only helps you, but helps other women in your life. How does that sound?
That sounds perfect.
Awesome. So Dr. Alli, can you just share with us what is HPV and who is the most susceptible to attracting this or contracting this, should I say?
And is it okay if I call you Danielle?
Absolutely.
Okay. So again, thank you, Danielle, for allowing me to talk about this today. I'm also co-chair of the Us versus HPV initiative, which is through the American Medical Women's Association. And every January, we have a dedicated week where we talk about this. So as you said, it is the most common sexually transmitted infection. HPV stands for human papillomavirus. And it's very common. So pretty much anybody who has sexual intercourse or intimate skin-to-skin contact will develop HPV in their lifetime. And so what we want people to know that it's not a stigma, it's not a failure if you get HPV. We just want people to realize that there are ways to prevent diseases associated with this infection. So this is a rare infection that's also associated with cervical cancer, vaginal cancer, penile cancer, also mouth and throat cancer. It's now #1 for mouth and throat cancer, as well as anal cancer. And because it's associated with all these different viruses, we know that there's ways to prevent that, and there's a dedicated HPV vaccine. And I'll talk to you guys more about that too.
I just learned something completely new. Okay, let's back up.
Yeah.
One of the things is we go to the doctors, right? We go get our annual checkups. We might go get screenings and testing for things. And one of my biggest concerns is I get tested, right? They talk to me a little bit in the doctor's office. If I come with questions, they have some general information that they want to share with us, but then we don't get the results until maybe a couple days later. Then I have a sheet of paper that has codes and words on there that I don't understand. So I'm blessed because I have 2 female doctors in my family who I can call and say, hey, can you explain this to me? And so I just learned something completely new. I had no idea that HPV is connected to these cancers. Can you just continue to dive into what that connection is and maybe how it develops into a cancer?
Sure. So good questions. And about 6 different, there are many different types of strains of the HPV virus. Some strains cause genital warts, but the ones that are especially concerning because they cause cancer are related to the fact that this infection, which the majority of women luckily will clear on their own without doing anything. So I do want to preface it with that. So reassuringly, most people who get this infection will clear the virus on their own. But there is a subset of the population that we cannot predict that will continue to have this virus show up on their pap smears. And then what we worry about is that the cells of the cervix being the bottom part of the uterus that kind of holds the uterus in place and also keeps the baby inside the uterus, that bottom part of the cervix can also increase risk for developing changes in the cells that lead to precancer. And then if they continue on, unfortunately can develop cancer. So, and while we talk about women, because the burden, unfortunately, of the disease often leads to progression of pretty significant cancers that require potentially surgery and chemo and radiation, we also know that men are often carriers of these viruses. And so if we can get more people vaccinated against this virus that causes these cancers, we can help to reduce the burden of the disease. But reassuringly, most people who get the virus will clear it on their own, but we don't know who will lead to a virus that persists and causes cancer. So we want people to be screened and then treated. And I can talk more about that.
Okay, my mind is going a lot of places. There's many connections coming. And y'all know I'm gonna go here because I gotta go here because I am who I am. This is so interesting because last night I'm a part of a book club. It's called Single and Secure. It is a book by Pastor Rich Wilkerson Jr., who's my pastor, and we were on the topic of sex. And in the book, it talks about, really abstinence and the benefits of saving yourself for a marriage and how sex was really created by God for the marriage bed. And he created it with a couple of things in mind, one of which is trust, commitment, and safety. And we went on to say, well, God didn't create sex or create these boundaries around sex because he didn't want you to enjoy your life. He created these boundaries so that you can enjoy it in a safe way. And so in my mind, it was just like, it just went off like, okay, this is another reason or another good idea around practicing abstinence, right? As an option, but also if that's not an option, safe sex as the other alternative. And like you said, making sure that the vaccines are there. And so my mind went there. Then my mind went somewhere else with the whole thing about just media in our society and the culture and Sexy Red. Do you know about Sexy Red?
Oh, tell me more.
Okay, so she's an artist and she's a young artist, but she promotes not having sex, safe sex. And as a result, she says things like, I don't care if I attract sexual diseases, sexual transmissions, or I've got this disease, but there's people in our culture and pop culture and popular culture who are really promoting these abnormal, weird ideas. And it's sad, it's sad because then you have a generation of young people who listen and look at the influence of these said artists and influencers and social media people who take it for face value and think that that's okay for life. Now, I know I went a different way, Dr. Ali, but I just had to share how all of these connections are continuing to come together. And then I'm so grateful that I have you on the show.
Well, you bring up some interesting points about pop culture and where we do honor the autonomy of the patient. So we know that people have the right to make choices that serve, and we want to make sure that they have informed choices, meaning that they have all the information so that they're making decisions that hopefully make for safe actions later on. And the tricky thing about this virus is that it is reduced significantly with abstinence. It is reduced significantly with fewer sexual partners. The challenge though, because someone could be abstinent and then have a partner and you don't know that partner's HPV status. You could be with just one person your whole life potentially and still develop HPV. And for some people, they won't develop abnormal cells that turn into cancer. Or for others, that virus can lay what's called dormant, meaning like it's sleeping and it doesn't wake up until later in life, and you could still have only one partner. And so what we're trying to protect is that for everybody in the population, acknowledging that sex is a normal part of human behavior. We just want to make sure that no matter how people choose to have sex, that for anyone who has a penis and has a vagina, that we reduce their risk, and a throat, mind you, a mouth and a throat, that we reduce their risk of getting cancers that are truly preventable through protection against this virus. And the number one is through the vaccine. Go ahead.
Through the vaccine. Okay, so HPV is also something that can be contracted to males as well?
Yes. Very good question. So we know whether men are having sex with women or men having sex with men, that everybody, no matter what their sexual preference, everyone who has intimate skin-to-skin contact, meaning people who are practicing sex directly by vagina to penis, vagina to vagina, penis to penis, anus to vagina, anus to penis, that your risk of contracting this virus is high. In fact, the majority of people, as long as they're participating in any sexual contact, will develop the virus. Condoms, not smoking helps. Again, not drinking heavily, eating fruits and vegetables helps. Managing stress helps, sleep help. All those things help, but unfortunately, there's only one proven way, incredibly 99% effective way to reduce that spread of the virus when people choose to have sex.
Why do certain demographics, and particularly women and communities of color, face a disproportionate burden of HPV-related health issues?
So there are a lot of thoughts around this. One is, so we do know that unfortunately, Black women are more likely to develop late stage cervical cancer by 1.5 times the incidence of, or the prevalence of, white women for that matter. What we attribute to are a couple factors. So it's not necessarily that there's something unique to our skin color, but rather often factors that impact how we have access to healthcare resources. So from getting screened for cervical cancer with pap smears, from how we get vaccinated and having early access to the HPV vaccine in our communities, to also how we may be heard when there is a symptom of concern. Like most of the time, there are no symptoms for cervical changes or cervical cancer until it's later and more advanced. But things such as finding spotting or bleeding outside of your regular periods, which should be about once a month, or irregular discharge, or pain, back or abdominal pain, and even in more unfortunate advanced stages like weight loss without trying, those would be symptoms that should be reported. And if a doctor or medical provider is not hearing the patient in the way the patient needs to be heard to get appropriate treatment early, unfortunately, we see a disproportion of patients seen as advanced stage in diagnosis or even dying disproportionately. One other factor I did want to point out is that there's more attention to the concept of weathering, which is another term that refers to the allostatic load or disproportionate stress from biases and discrimination related to race and racism. So in particular to racism in healthcare. And so the risk that that has on the body. And we do know that there are a lot of studies and data that tie stress and chronic disease. Those are factors we can discuss further. And you were going to ask me a question.
Yeah, can you just describe what abnormal discharge would look like, or so we are aware of that?
Wonderful question. So abnormal discharge would be unique to that person. So typically it would be anything that's new or different for you. Typically we see that as having an odor. Sometimes it can be brown or yellow or green. And then it would be basically things that are outside of your normal body function. And if you have any questions about that, we would want each patient to feel empowered to talk to a medical professional, licensed medical professional, so they can evaluate that together. But typically it would be something that comes outside of your normal day-to-day vaginal discharge, because you can have normal discharge, but if it has an odor, has a smell, and is different in appearance or color that compared to what you're used to, we'd want you to be seen.
That's so good to know. So I definitely want to just back up a little bit, because I want us to talk more about what the American Medical Women's Association, what the association is all about, and what its role plays in promoting women's health.
Wonderful question. So I'm on the board of directors for AMWA, which is short for the American Medical Women's Association, and we are an all-female physician organization. We're actually the oldest multi-specialty women physician organization in the world, originating in 1915. And our goal is really to center women physicians and women's health rights. And we do that through advocacy, through programs, through bringing awareness and attention to priority topics, from everything from disease prevention to gun violence to women's reproductive rights. We just really believe in prioritizing issues that uniquely and unfortunately impact us and our families and our patients. It's been a phenomenal organization to be a part of, because we really have something for everyone to speak about.
And it's a national association?
Yes.
Okay, and then you have just members and doctors, different states, different cities.
Yes, and we actually are a very inclusive organization. So we are really open both to partnership and to members from all different specialties. And
oh, that's awesome.
Yes.
Different industries, such as if women in media wanted to be a member of your organization, we could join.
We support everybody. Yes.
That's wonderful.
We understand that to move the impact in the direction which is towards health and equity, that we need everybody on board. And so we truly mean that. And our executive director is Dr. Eliza Chin. She is very much a proponent of bringing advocacy as ways to make these changes systematized. We know we can do this. We've been doing great work for decades. And yeah, we're just grateful for the fact that there are people like you in your industry that are doing great work also.
Thank you so much. We commend AMWA since 1915, doing incredible work, saving lives and really advancing women and really teaching us about our health. So this is very impressive. I'm so glad we connected. Thank you.
You're welcome.
I think we've already covered some preventative measures about HPV that are available. Is there anything else you want to add to that particular topic? Any options? Anything else we should know before we move on from there?
So you're asking some great questions. One thing that I think is important for people to know is that the vaccine not only helps to prevent the virus that's associated with 6 different types of cancers. And just as a quick additional point, ideally the best time to get this vaccine is before people have their sexual debut, which means before people are sexually active. So
Who knew that?
Yes.
Who knew that?
Right?
Sex
So
ed in high school, you failed me. You failed me.
Well, we're trying to bring more awareness to it now, which is the good thing. So ideally, we want to start vaccinating people even as early as 11 years old and even as young as 9 years old. So again, before people become sexually active. Vaccinating, though, doesn't mean that we want or endorse or plan to get sexually active at that age. It just means we're trying to protect our young
Preventative care.
girls and boys. Yes, because everybody gets exposed to this virus and we can't predict who's going to get cancer. But even after the age of 11 and 12 or younger, we recommend vaccination, and it's available up until the age of 45 years in the US. And we anticipate that age to cut off to be expanded even older age, because there are incidences of cervical cancer even in older people, anal cancer even in older people related to HPV.
Okay.
So the other thing I wanted to emphasize is that this vaccine also reduces the burden of disease for people who've been exposed to HPV and its cancers. Can actually reduce some of the burden of the cancer by as much as 66% in some of the data. And that's also related to genital warts. So if we can reduce the burden of disease with this same vaccine, why not? So it's not too late. People who didn't get it before they were sexually active, but they can also get it even as they're older. And then the last thing I wanted to emphasize to bring point home is that even in people who are not planning to be sexually active, active, unfortunately, we know that the data shows 1 in 4 young girls and women are exposed or deal with unwanted sexual
Right, exactly.
unwanted sexual
Those experiences,
including rape, sexual assault. The more that we can protect them from some of the consequences, unfortunately, the better, in addition to just protecting them overall from these unwanted exposures.
The more that I learn about this and talk to you about this, the more the passion in me is to move to want to continue to spread this message, because that number that the American Cancer Association just predicted, 4,360 women, we can help reduce this. We can do something to move the needle forward. So for everyone who's tuned in, who's listening, I need you to go ahead and just pause right now and just go ahead and start to share this. I need you to share it on your social media. I need you to put it on your YouTube. I need you to share it with women in your life who you know, who you care about. This is great information. There's so many mothers in our network. There's so many grandmothers and so many women, all of us. Do your part, do what you can, and just help to spread this message, because it's going to be vitally important to the livelihood of women. So I know that AMWA just did something really incredible in DC. Can you talk to us a little bit more about that?
Yes, we're always doing something incredible. The one I think you're talking about more recently was the Obesity Summit in Washington, DC, where we convened women from multiple different specialties to talk about how do we help our patients who are struggling with the both mental and physical burdens of chronic obesity. How do we help them so that they can be in their healthiest selves? And so we know that obesity is really not only a disease of what we eat, but it's also a genetic problem. It's also a mind problem. It's also a brain disease. And so the more that people have access to knowing how to effectively tackle this problem, the more that we can really help our patients who are often dealing with the stigma of being overweight and obese, and they don't deserve that.
Was there something with Us versus HPV Prevention Week that happened also?
Yes. So every January, we have a dedicated week where we center speakers from all over the world to talk about the human papillomavirus and how to reduce the burden of diseases associated with those cancers. These 3 sets of this vaccine. So the vaccine is done in 3, starting at month 0 and then 2 months and then 6 months apart. And we know it's 99% effective at reducing that risk of cancer. And so about 6 different cancers that we can prevent. And so in today's day, we can say with confidence that if people are developing cervical cancer, it's because they aren't getting access to adequate screening through pap smears and looking at the cells and the DNA for the virus, which should start by age 21 years. And they're not getting vaccinated. Those are the reasons why we're now seeing the burden of disease. So we have ways to prevent it. And if you look at countries like Scotland, for example, that started these efforts around 2008, they don't have cervical cancer anymore. So over the last 6
Scotland?
Yes. And Australia is on a route to do the same. So
were they at the preventative week with you all?
No, we didn't have them at this discussion. We had other countries like Nigeria, and there are a couple other countries around the world that are starting these efforts alongside. But just pointing out that there are countries that have the same level of access that the United States does, and they were able to eliminate that burden of cervical cancer. So we can do the same here. That's the reason I bring that up. Yeah, they don't have cervical cancer anymore. And women who were vaccinated with the 3 vaccines at age 12, 13, they were able to eliminate cervical cancer all throughout their country. So
12
it's a big
and 13.
deal. Yeah, but we can do the same. And if you didn't have a chance in your youth, do it now, because we know even if people contract the virus now, or they've had exposure to it, or they have the cancer, that they can still reduce the burden of disease, even vaccinated at older age.
Let me go. Just let me grow. Don't smother my potential. Let me be what I was.
Introducing the WIM Speaks Show, produced by Women in Media Global. Join us every Sunday at 10 a.m. on Video Mix TV for entertaining and empowering stories, insightful interviews, and inspiring content hosted by Danielle P. Tune in and elevate your journey with us.
Chasing and I keep on embracing.
So let's talk about that. So for our listeners tuned in, what would the next steps be? Should we just call our primary care physician? Should we call our OBGYN physician and just say, hey, I want to get the vaccine?
So wonderful. I'm glad you asked. There are a couple things to know. One is that your primary care doctor, who's usually your first line, your first call for any kind of symptoms, a lot of primary care doctors do women's health and do pap smears, can help to evaluate you for your concerns. And if they cannot, they will then engage OBGYN. So the gynecologist can see you and do the same pap smear and look at the cells under the microscope and identify if there's a concern for early cell changes, for precancer, or early signs of cancer, or much, much more concerning for advanced stage cancer. But the goal is to make that call first and get in to be seen. If you don't have someone already that you see, the CDC has a dedicated website, and I'll share that with Danielle, where you can go on their website and search for not only cervical cancer screening, but also breast cancer screening. So people who can help you to get locked in. And there are also resources through programs like Planned Parenthood, where they can also help with that. The key though is start by age 21 years. That's typically the age that we start pap smears.
Pap smears.
You got it. And to make sure not to delay that, because where we start to see the progression into early changes of the cell of precancer is after the age of 21 and up.
So we'll definitely make sure the link will be in the description of this show. You'll be able to click that link to the CDC and get the resources that you need. And again, share it. But Dr. Ali, if I want to make sure that I'm being preventative and I just say, hey, I just want to make sure that I get the HPV vaccine, do I have to go through the pap smear first, or can I just sign up and get the vaccine and just make sure I'm all good?
Excellent question. I couldn't have planned them better. So your doctor may be able to give you the vaccine, but to your very good point, you do not have to go to your doctor to get vaccinated. And that stands for most vaccines. If you do have health insurance, call your healthcare insurance company and ask them which places are contracted to get vaccinated. You can go to any place like CVS, a Walgreens, a Safeway, any of those typical places that offer vaccines, and let them know that you want to get vaccinated. Just make sure that if you're trying to get it covered through your health insurer, that you contact them to see who covers that. If you're over 15, it's 3 sets of vaccines over a 6-month period. And then if time gets busy and you forget to get vaccinated at 0, 2, and 6 months, you just start when you remember. So you don't have to start the whole series all over again.
Okay.
Yeah, we want people to get vaccinated. Under the age of 15, typically it's a set of 2 vaccines. And that's something that the pediatrician can help those patient populations with. But yep, that's a great question. You do not have to go to your doctor for that, but you do benefit from going to your doctor for your pap smears and then the DNA testing for women over 30 years. 1 and up, get screened.
That's awesome. Make sure you sign up to get your HPV vaccines, ladies. Let's go ahead and make sure that we put that on our to-do list this year. 1, 0, 2, 6. You can get them all done in 2024. It is the top of the year to let's prioritize our health for sure. You mentioned that Scotland and Australia have been able to eradicate HPV for their women population, so kudos to them. Is there any other latest innovations or treatments or anything that's going on in HPV prevention that would be good to share?
Yes, for women who are unfortunately suffering from the burden of cervical cancer at any stage, there are a lot of interventions that are available to patients. So we know that in pre-cancer changes, they often will monitor those closely, remove cells that are abnormal. Typically in early stage, that requires more complex surgeries. An advanced stage, in addition to surgery, patients will often require chemotherapy and radiation. And they also have a dedicated localized radiation called brachytherapy that is really important. There's some great work being done with a company called Mission Tech, where it's actually a Black woman physician as the co-CEO of this company, and they are bringing forward to FDA some great innovations to make brachytherapy more comfortable for patients. But the other point to emphasize is that we know that patients who are undergoing this process of treatment, and if they want children, that it doesn't necessarily mean that they are no longer able to have fertility sparing options. So there are ways for some of these women to still be able to have children despite going through some pretty rigorous treatments. So that's what's out there. And again, vaccinating even in the populations that have HPV and cervical cancers or penile cancer or anal cancer can reduce the burden of disease. And in some, even contribute to reversing the findings of the cancer. That's what's impressive, is that this virus can even help reduce the burden of disease in patients who are already dealing with the cancer.
I am loving this episode. I'm so grateful to Dr. Ali for being here at this episode. If you are enjoying this episode, go ahead, click the like, give us a like, give us a comment. So I want to make a really good connection here. As you know, we are Women in Media Global, and so the women in our network are producers. They are podcast hosts, they are directors and actors, and they are really creating a lot of the news that we hear in the everyday online and on social media. So as a physician and an advocate for health equity, how do you envision leveraging media and storytelling to raise more awareness about women's health issues, and particularly those related to HPV prevention?
So that's a great question. We know that disproportionately women will describe not feeling heard when they go see their clinicians. And often that is the case, unfortunately, that a lot of the way that we look at disease models is often with patients that are male or not of underrepresented or minoritized or Black and brown communities. And so we want more people not only to tell their stories of when they're not heard, but also to share information what is working. So I often teach patients about communication techniques. So in addition to bringing somebody to your appointment to be a co-advocate with you, I also talk to them about using terms like, what I see is this is the problem. So what I'm concerned about is this is the underlying cause, and what I would like is this kind of support. And that model comes from the VA system as a tool to improve communication in the healthcare system. So for example, to the point of HPV, it would be like, what I see is that I've had some new spotting and changes in my discharge, doctor. Heard this awesome podcast through Women in Media, and I'm worried about cervical cancer. And what I would like is your evaluation to help me know if I have concerns for cervical cancer or other ways that I can reduce my risk factors. And so when we speak in a way that is specific, concise, and direct, people can improve their likelihood of being heard and getting the care they want. But that said, we also know that sometimes that still doesn't work. And there's no reason, with the number of doctors that we have in the United States, for you to stay with one person if you don't feel like they're being heard. And find someone else, and it's important because you're the only one who will ever love your body as much as you. So we want people to make sure that they keep making noise until they're seen and heard by the right person. The other point I wanted to bring up is that lifestyle medicine uniquely centers health equity. Health equity being that people who are disproportionately burdened by diseases, unfortunately, often Black and brown communities, related to resources or communication or challenges around how they're seen and heard, biases, that we can bring to those populations, and really everybody, frankly, more understanding of what we can do to prevent, treat, and even reverse chronic disease. And that is through how we eat, how we prioritize things that nourish us and bring us joy in our life, how we exercise, how we manage stress, sleep, and then how we make time for the things that recharge us. And so it's incredibly important that concepts like WellNEST, which is what that stands for, so building a well nest, again, be between activities, eating, exercising, stress and sleep, timed mindful breaks, that we prioritize that so that we can reduce that disease burden and rely less on healthcare systems. So the more that we can take control of those aspects of lifestyle medicine, we know that we we can reduce the burden of disease, because the CDC data says 80% of chronic disease is related to deficits in those areas. That's the message I want us to promote all throughout the channels and all the communities that we hear it, is that when we can take control over eating more whole food, plant-based, that means the apple, not apple juice or applesauce. When we can take walks, ideally 30 minutes, 5 days a week, increasing that heart rate during that time. That when we can manage stress with things like mindfulness and meditation, when we can drink water, drinking when you're thirsty, prioritizing water above all other types of liquids, when we can make sure we're getting good quality restorative sleep, that when we can make those changes, Danielle, we can rely less on healthcare systems, rely more on ourselves to make those changes, and really impact our communities and each other. And that's the message to spread.
There's an affirmation that I often say, and it says, I already have everything I need. Everything I need is already inside of me. And so what you just shared are preventative ways that if we have a active plant-based whole food plant-based diet, like you said, we can do preventative measures to make sure that we live long lives and that we are doing our part to just protect us and to see us live on and to protect the legacies that we're creating, because so many women in our community here and our sisterhood here are building big brands. They are building companies. They're putting their passion and all of their time into it. And so you want to see the fruits of your labor. And so you can do that by making sure that you are well. And so with that being said, Dr. Alli, what ways do you want to see media platforms get involved? What can we do on our podcast shows, on our talk shows, our TV shows? A lot of us are on the radio. We are creating media and even creating shows online. What do you want to see these platforms do in support of more positive news around preventative medicine, preventative lifestyles, and also HPV prevention and even cervical cancer?
So Danielle, what you're doing right now is already a big, huge jump forward. And that is making this platform available to everybody so that they can understand that it's not just a discussion point for those people who are able to get to see their doctors, but that everybody needs access to information to reduce their burden of disease. So the more that we spread messages and make aware that these are viruses that are everywhere and that there's nothing wrong with you if you have it, but we want to reduce the risk of cancer and disease burden, the better. And oftentimes we may be saying that, but not everybody who needs to hear it is hearing it. So the more that we make messages like this available to everybody, the better. And that's, I think, great what you're doing.
Thank you so much. Ladies, let's do our part. Let's make it happen. Make sure we're spreading this good news. So we're coming to a close here, and so much information that I wanted to get out, and a lot of the questions have already been answered. We have been able to share so much great information. So let's go ahead and just finally, let's wrap up those action steps again. Let's go ahead and repeat what individuals can do to optimize their risk factors and reduce the burden of HPV related diseases in their lives. I want to make sure we bring that point home.
So the first is that everybody who is sexually active has a high risk and likelihood of getting HPV in their lifetime. That there's nothing wrong with you. It's not a thing to stigmatize, but we do want to do our part to reduce that risk. Early vaccination, especially in childhood, helps to reduce that risk of cervical cancer and other cancers like penile, like anal cancers, and mouth and throat cancers later in adulthood. And getting vaccinated in childhood does not mean that we are suggesting people get sexually active at that age. We're just reducing the risk because it affects everybody. The next thing to emphasize is that when you get vaccinated, there's 3 series. It can be done through your doctor's office or in a pharmacy that offers vaccines. Make sure to complete the series for your benefit. We also want to emphasize that screening is really important, starting at age 21 years, and that can also catch those cell changes that can be markers of cancer early so that we can reduce the risk of people dying unnecessarily from this virus. And I also want to emphasize that tell people that you love, men, women, anyone with a penis, anyone with a vagina, anyone with cervix, anyone with the anus, anyone with a mouth or a throat is at risk. So we want everyone to get vaccinated. We know also that populations that are immunocompromised, like HIV, we want to make sure that they are also getting vaccinated as well. The vaccine has very few side effects. Don't believe the hype. There's a lot of data that's misinformation. If you're not sure about it, ask a licensed professional. We can review the truths, but few symptoms associated with just usually redness, pain and swelling that goes away pretty quickly. So get vaccinated to reduce your risk. We know it works, and we know it can even reduce the risk of disease burden in people who already have cancers related to this virus. So thank you so much for inviting me to talk today.
Thank you, Dr. Ali. We have had a wonderful episode here. I actually have 2 more questions to close out with you, but I want to say that Women in Media, we're about empower, equipping, and encouraging women to own their voices. And Dr. Ali, you have done that. Not only have you owned your voice, but you have raised the concerns for all of us and to let us know what we should be aware of as far as HPV prevention and also cervical cancer. And we're super excited that AMWA is also owning their voice and going around since 1915 and really helping with women's health and advocating and supporting for women's health. Before we get out of here, these last 2 questions. Is there any other remarks or encouragement that you want to leave with our listeners for them to take charge of their health?
Yes. What I would say is that make it so simple to make these small changes related to WellNEST and lifestyle medicine. The easiest way to think about it is make it easier to do the things that are important to you, make it harder to do the things that are not, and be kind to yourself as you make these changes. So let's say you wanted to start walking more regularly. If there's something you already do, let's say you already brush your teeth every morning, do a lap around the house before you get to that toothbrush, and then maybe walk and brush once you don't trip. But something small like that can make a difference. And even short bursts of exercise all throughout the day counts in terms of reducing your risk for heart disease and even things like cancer. Small changes are helpful. Make it harder to do the things that are not helpful. If it's clear that something is stressing you out, consider, is this something that I need to do in my day-to-day? Are there other ways that I can do this, and do I need to get help in order to manage that? And that might even be talking to somebody like a therapist or psychologist or your primary care. And then just giving yourself grace and kindness as you make these changes. Everything is hard at first. Remember when you first started to walk? You probably don't, because you forgot about it because it was so long ago. But it was long ago. Right? It was probably hard at that time, but you persevered, you got through it, and look how you walk today, or look how you move your And just being inclusive, the goal is to do something that's difficult for you every single day until it gets to be easier. But if it's not serving you, then consider, is there a different way, or do I need to continue to do it? So we know that those things work, and that's what a quality improvement approach is all about. And we know that the more people make these changes, the better off they are. And we can even reverse diseases like diabetes with these kind of changes.
What great advice, what great support, helping us to improve our health. This has been an amazing episode, all about improving our lives in 2024 and beyond, and everybody around us, as we can support them with this information as well. So in our very last question, we asked everyone who appears on the Women in Media show, wise words learned from women. So what piece of advice or wise word did you learn from a woman in your life, and what was it, and who was she?
So I have many fantastic mentors. I'm really grateful for that. Starting from my own mom and my aunt, my sister, to women physicians who've been mentors and sponsors to me. But I'm just going to think of something that came off the top of my head, and that was, they told me to always prioritize the things that serve me and not the things that don't. From simple things like, if you know that it's a high burden to, let's say, something simple, like let's say you like to eat beans, and cooking beans from scratch is a pain in the butt, buy the canned ones, just rinse them from salt. Or even something more complex, like, you know that as a busy healthcare professional, like in my case, let's say doing laundry didn't serve me, then I would outsource that. I'd do my laundry, but yes. that would be something I'd outsource. So, and that's what they told me, is that it's okay to get help and to outsource the things that add undue burden, and then to make time for the things that don't. So that was the lesson I learned.
Awesome. Thank you so much. All of Dr. Alli's information is going to be right here in the show notes and in the episode. So make sure that you check her out, stay in touch, WellNEST Medicine, AMWA, stay connected and share this information. We are Women in Media and we have spoken. Thank you. Until next time.
Thank you too. All right.
You ready? Hey, I'm ready. I'm ready. I'm ready. I'm ready. I'm